Motivational interviewing is a collaborative, person-centered approach to conversation designed to enhance an individual's motivation to change by exploring and resolving ambivalence. In the upcoming scene, you will see an emergency room healthcare provider, Dr. Pedigo, navigating a difficult conversation with a patient, Alisha, who discloses they are experiencing intimate partner violence. Dr. Pedigo will use key motivational interviewing techniques to support Alisha while she considers her next steps.
Hi, I'm Dr. Pedigo. Can I ask what name you'd like me to call you while we meet today?
Hi, you can call me Alisha.
Nice to meet you, Alisha. Can you tell me what brought you in?
I don't really want to talk about it.
Okay, I understand. I see you're here with some injuries. I want to make sure I have the information that will help me care for you the best that I can. Is there anything you care to share with me about what happened?
I fell down the stairs.
That sounds painful. I'm here to help you with your injuries, and I also want to make sure you're safe. Sometimes people end up here because of situations they find hard to talk about. Is there anything more that you'll like to share?
No, I just want to get treated and leave.
Of course. I work with a lot of patients with injuries who have hesitations or mixed feelings about sharing what happened. Can you tell me more about how you're feeling right now?
I don't know. It's complicated. I just want to go home, but...
What I'm hearing is that you're here because you know you need treatment, and you also have some hesitation about going home. It sounds like you have a lot on your mind. What makes you hesitant about going home?
I don't know. It's not always safe there.
I'm sorry to hear that. It can be really hard when a place like home that should be safe isn't. And it sounds like home isn't always a safe place for you. Can you tell me more about what's been happening?
I don't know. Sometimes things get out of hand with my partner. Not always, just sometimes.
It's true that that can be common for things to be going on in a relationship that causes mixed feelings. It sounds like there are times that are fine as well as times that feel unsafe. It's okay to feel conflicted about what's going on in your relationship, and you deserve to be safe. What do you think you need right now to feel safe?
I just don't want to make things worse. If I tell you too much, I'm afraid of what might happen.
Your safety is really important to me, and if we know more about what you're worried about, we can make a plan to help that doesn't make things worse. What would make you feel more comfortable talking about your situation?
It's been easier to talk here, where I have some privacy. It feels like he never leaves me alone. I just want things to get better, but I'm scared.
I'm glad you have the space to talk about it, and it makes sense that you feel scared and uncertain if you're in an unsafe situation. Since you're here and have privacy to share openly, do you think that you could identify what steps you could take to feel safer? How about just a small first step?
I don't know. I guess I could talk to someone about things a little more, but I don't want to get my partner in trouble.
I hear you, and I'm glad you want to share more about what's been going on. While you're here, I can connect you with some resources, and we can discuss ways to keep you safe without immediately involving others, if that's what you prefer. We can explore some of those options together.
Oh, okay, I think that might help. I just don't want to feel so alone in this.
I can understand why you feel that way. Please know that you are not alone, and we are here to help you through this. Let's take this step by step and find a way to support you. And with your permission, I'd like to connect you with one of our hospital social workers who are very knowledgeable about resources and can work with you to figure out a plan. What do you think about that?
I think that's okay.
Great. Is it okay for me to take a closer look at your injuries?
Motivational interviewing techniques, such as exploring ambivalence, open-ended questions, affirmations, reflective listening, and summarizing, can help navigate even the most difficult conversations. These techniques help build rapport regardless of whether the relationship with the patient is new and brief or established and long-standing. By focusing on the patient's feelings and supporting their autonomy, individuals can feel empowered to take steps towards safety and well-being.